remain under what feels like indefinite lockdown conditions, more are taking to drinking to cope. A YouGov survey has found 1 in 5 Australians drinking more alcohol since restrictions were introduced. So, what sort of support is available for those concerned? Joining us live is Katerina Giorgio, the CEO of the Foundation for Alcohol Research and Education. I don't think, Katerina, those stats would be much of a surprise to most people living through lockdowns at the moment. Just how much more alcohol we're drinking, and have you found that certain demographics are more at risk?
What we're seeing is this huge flow of alcohol into the home. So in 2020, we saw an extra $3 billion worth of alcohol being sold into homes, and that's continuing in 2021 as these restrictions and as COVID continues. And interestingly, something that we're seeing through some of the harm data that's coming out, so a report on ambulance call-outs in Victoria found that even higher socioeconomic groups are increasingly needing support because of harms or because of alcohol intoxication.
Okay, so this is probably a good chance to give everyone a bit of a reminder about what the current guidelines are as to how much we should drink, and what are the warning signs we should be looking out for if people are thinking, oh, I'm not really sure if this is a problem for me or not, or they're saying, well, I'm extra stressed, I'm feeling more anxious than usual, this lockdown scenario is really difficult, and I'm allowed to give myself a break and drink a bit more at the moment. What sort of advice do you have for those people?
Yeah, it's a really good point. So what we know is that the guidelines say that we shouldn't be consuming more than 10 standard drinks in a week and 4 standard drinks in a day. And a really important thing to note is that a standard drink is often smaller than we think. It's often smaller than a poured glass. And if people are noticing that they're unable to engage in their everyday activities as they normally would, if they're finding it hard to stick to the limits they're setting themselves, or if someone in their household has indicated that they have concern about their drinking, then they're just some signs to have a look at your drinking and see if you might need some support to cut back.
And for those people who make that decision, need some help, what are some easy strategies to cope with that? And are you finding that those services that are available to help people with these issues are being overwhelmed, like some of the mental health helplines, for example, who we know have really seen a marked increase in demand for their services?
Yeah, it's a really good point. And what we've seen with the AOD helpline, or the alcohol other drug helpline, is there's been a huge increase in calls to them as well. What we know now is there are lots of online supports as well as face-to-face supports, and there are phone services that people can call as well. So it's really important, if people think that they do have a problem or they're concerned about someone else in their household, they can call 1-800-250-015, and then they can find out about the different services that are available. One of the things about the restrictions is that it has moved a whole bunch of supports online. So there's the opportunity to access these types of supports in ways that we haven't been able to in the past.
And are we seeing that boost in alcohol use at home leading to more family violence? Is that a pretty clear correlation?
We're really concerned about this. And if you think about $3 billion of extra alcohol going into homes and think about the harms that were already occurring beforehand, this is something that we're really keeping an eye on. We undertook a survey last year that found for New South Wales workers in family violence that they had seen increased involvement of alcohol. And we know that when alcohol is involved in family violence, it makes it more severe and more frequent. And so we really do have concern about the hidden harms. You know, the feeling that I have when I think about that alcohol really flowing into the homes across this time period, particularly for people who might have been struggling before now, it's something that we should really be worried about, and it's something that we need to try and get on top of to try and prevent.
Katerina Giorgio, appreciate you joining us. Some good advice there for everyone. I appreciate your time. Thank you.
Thank you for having me.